For the last 6 weeks, mysterious blisters have been erupting all over Katie Faust's arms and legs, and now cover nearly 70% of her body. Her doctors have no idea what's behind the outbreak or how to stop it. Making matters even worse, officials on her college campus are now raising concerns that Katie's condition could be contagious.
In order to stay in the dorms, I had to go to the student health services at my college to get checked out by the physicians there. I was really scared at this point. I had huge blisters on my arms and on my legs. The rash was pretty much covering my skin in the areas that the blisters weren't present. All of the doctors that were working that day came in to look at me. They were very freaked out. They had no idea what was wrong with me. So they sent me to a local dermatologist, Dr. Sims, and fit me in as an emergency appointment.
When I first met Katie, she was understandably anxious.
I told her the progression of things.
What was interesting about it was the number of blisters that she had. And she had lots of patches of pink inflamed skin. Mostly these were on her arms and her legs. And sometimes the blisters actually formed a very symmetrical pattern that suggests that this is something coming from the inside of the body. The most important test was to do a biopsy. So I biopsied a tiny blister on her thigh.
When she did that, I was extremely hopeful because no one had made a step like that before. You know, they were actually testing my skin.
It takes usually about 6 to 7 days to get a biopsy report back.
At first, Katie is determined to get through the long wait by herself. But after a few days, the uncertainty becomes unbearable.
She called us at the point where she was getting panicked. My fears were that she had something really bad and that we should probably have her drop out of school and come back home.
At that point, I talked to Katie's mom. She was very anxious about her daughter being several hours from home and her not being able to be there.
It was tough waiting for the results, but at the same time, I was afraid that it would have been some disease that there wasn't a cure for.
After an anxious week, the lab report finally arrives on Dr. Sem's desk. And it doesn't take long for her to zero in on the source of Katie's problem.
What really clinched the diagnosis in Katie's case was a test that showed that there were antibodies were on the roof of the blister. With all that information, the only diagnosis that she could have would be bullous pemphigoid.
Bullous pemphigoid is an autoimmune disorder of the skin. In a healthy individual, antibodies help guard the body against infections and foreign substances. But in patients like Katie, for some unknown reason, they attack the tissue that joins the top and middle layers of the skin, weakening and separating them. The result is severe inflammation and blistering.
The epidermis, or our top layer of skin, is attached to our dermis, the second layer of skin, by something called the basement membrane. The basement membrane is basically the place where the glue is that holds the epidermis onto the dermis. And that glue is what gets attacked in bullous pemphigoid. So as the antibodies attach to that area, they cause inflammation to occur.
Surprisingly, what Katie thought was the initial symptom, her rash from the TB test, had nothing to do with the condition at all.
When Katie's rash first started, she just had the TB skin test done on her forearm, and I think it was somewhat coincidental.
In fact, the first signs of the disease were the red raised marks that Katie thought were insect bites.
When bullous pemphigoid lesions first start, they're often just pink, swollen, itchy areas, and they can look like a bug bite. So there's often quite a bit of itching because of the inflammation.
And as the inflammation gradually increased, it was only a matter of time before blisters started to form.
When there's inflammation, there's swelling. That swelling is caused by fluid coming to the area. There's increased blood flow to that area, and that increased blood flow basically causes leakage of fluid into the tissues. It causes so much inflammation and swelling that enough fluid collects underneath the skin to force the skin up and into a blister.
I felt great to finally have an answer because I could start getting better, could start getting my normal life back.
But despite her relief to finally have a diagnosis, Katie can't help but wonder why so many other doctors were unable to identify the disease.
If you take 100 patients with blisters, 99% of them are going to not have bullous pemphigoid at least. The majority of people who get bullous pemphigoid are very old. It's not a really common disease. I think I probably see a patient a year maybe with bullous pemphigoid, but about 90% of them are over 80 years old.
How did this happen to an 18-year-old girl?
There's no known trigger to this, and why it manifested in her at such a young age, we really don't know. We don't know what causes bullous pemphigoid. All of the autoimmune blistering disorders are caused by antibodies that the body develops, but we don't know what it is that first starts the body to make those antibodies.
Katie may never know what triggered the disease, but now she and her doctor have more pressing concerns: how to deal with it.
The worst case scenario for bullous pemphigoid is when you get more than 80 or 90% of the body surface area affected. And the biggest problem there is open sores can be at risk for infection, so that those things can actually be quite dangerous and even life-threatening.
Katie desperately needed a solution. She needed to start to get better.
After enduring painful and disfiguring blisters for 2 months straight, Katie Faust has just learned that she's suffering from a rare autoimmune disease that can be deadly.
It made me scared, but at this point, I was just ready to start a treatment plan.
While there is no cure for the disease, it can be treated.
The first thing we did was to put her on oral steroids. These usually work great to suppress the antibody that's triggering the disease.
I just really wanted to know how long I was going to have to live like this. I wanted things to go back to normal so badly.
She actually got quite quick relief, so that blisters started to heal and blisters stopped forming over a week or so. The goal usually over time is to taper down the dose. Many times as we taper therapy, we'll hit a point where all of a sudden blisters will start to form again and we'll have to up the dose again. So many times we'll add on another medication to suppress the immune system that then allows us to get to lower doses of the steroids over time.
The combination of the immunosuppressant and the steroid eventually got rid of everything altogether.
Katie was able to get off of her medications at 14 months after we diagnosed her.
But while the treatment is successful, Katie will have to remain on guard for the rest of her life.
It is possible for her to have some recurrences here and there. You really don't know if she's going to have recurrence until you see a blister.
Bullous pemphigoid is a chronic condition, so I will have to deal with flare-ups for the rest of my life, but nothing will be as bad as the first time because they know what it is now and because they know the medicine that works for me.
Today, Katie is healthy and on track to fulfill her dream of running her own restaurant one day.
Last December, I graduated from college with my Bachelor of Science degree in business management. I am currently working at a fine dining restaurant in Columbia, Maryland.
Katie is great now. She is 100% back to herself, 110%.
The diagnosis has definitely taught me not to take my good health for granted.
I didn't understand how it couldn't leave scars, but it didn't. She has great skin now, she's got a great life ahead of her, and she's off to a great start.
I'm just thankful for having confidence again. I'm no longer worried about what people think of me. I have my life back.